Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster. My guest this morning is Shireen Abdullah, the CEO and founder of Yumlish. Shireen, so great to see you.
Good morning, Logan. So glad to be here.
Let's just start by level setting on what Yumlish is.
Yes. Yumlish is a nutritional health platform. Think of it as the Peloton for nutrition.
Okay.
Yeah.
Unpack that for me.
Yeah, happy to. So what that means is we're providing content, live, on-demand content that leads people to make healthy nutrition choices and informed nutrition choices for themselves.
Okay, let's talk about online nutrition information for a minute, because we are being inundated by misinformation and by over-information.
Yeah.
So sort of what do you see as the major challenges when it comes to what people don't know about what they should put in their bodies?
Yeah, that's a great one because people don't understand simple things like, and this is across the board, simple things like what is a good carb versus bad carb?
Okay.
How do I eat healthy for my family so that my child doesn't get diabetes? These are very simple things, and I feel as health tech, we've overcomplicated a solution that works best, And so within this context, what that means is walking people through a grocery store virtually.
Okay.
This is how you shop. This is what a nutrition label is. These are the numbers that you should look for. When you come to this, how do you select fruits? I mean, just basic things that somehow your physician, your primary care provider expects you to know about your health and just tells you, hey, go eat healthy, but no one teaches you.
What I hear you saying is that you're finding a lower common denominator for education versus waiting till somebody Googles what kind of diet I should have. You're kind of like saying, well, let's start with how you read a nutrition label.
Yeah.
Is that right?
Yeah, just taking it back to the basics. We've taken it for granted to assume that people know a lot of things about their health, and the population we serve doesn't. I mean, a lot of people don't.
Yeah.
And again, we just assume them to know, but when we come from that place of providing that education, meet people literally where they are in the grocery store, when you meet them where they are, you're able to create trust. And that is the core of what we're doing, is building that trust with them.
How do you think about building trust? What are some of the methods you use?
Yeah, so part of that is talking to them about food. Food is something you and I can connect on. Take random two people here and they can connect on it. You can talk about food and what works for you and what irritates you and what you've noticed about your health and what you're trying to, try or whatever. And
what your family eats.
What
your
family
community
eats. Exactly. In your culture, your cultural foods, there's so much to connect on when it comes to food. And when you start with something so, so basic like that, you make these connections whereby then they start telling you a bunch of other things that are not even nutrition related.
Oh, interesting.
And that, to me, is the true value of creating that trust, because from there, we drive them to other services. So what that means is we can drive them to screenings, get your eye exams, get your foot exams. This is specifically for a diabetes population. We can do SDOH screenings, food insecurity screenings. We can do all sorts of different things once we create that trust.
Got it. So the diet conversation, which someone is thinking about pretty much 3 times a day, if not all day, is the entry point for talking about more holistic health, is what you're saying.
Exactly.
Interesting. Okay. I want to talk about your deal with the Air Force, because you've got a really interesting application of this. Typically when we think about diet, we think about direct-to-consumer, we just think about your average person trying to eat a healthy meal, but you're working with the Department of Defense. Tell me about it.
We are. So we're essentially working with them to try to figure out how to manage the weight of individuals that are coming into the Air Force, they're enlisting, and as they're coming in, there is a weight management component to help them meet the physical fitness requirements they need to in order to successfully complete recruitment.
And why is that an issue right now?
Oh boy, you're ready for this one, Logan. 75% of the population today, of the youth between 17 to 24, doesn't even qualify for service. One of the top 3 reasons is weight and obesity. So now you've got this 25% of the population that you're working with, so you can do the math from there. Every single one coming through that pipeline is very important and precious to put through.
Interesting. And I mean, talk to us about sort of the downstream impact of not being able to recruit.
Yeah.
And the importance of tackling this challenge at the root.
Yeah, I'll say this. Obesity is now a national security issue.
Fascinating. Is that how folks in the Air Force think about it?
It is. It is a huge problem across the military, in fact. When you look at the other branches as well, time and again we're seeing year after year, especially after COVID and coming out of COVID, there are huge challenges in recruitment. There are huge challenges in sort of meeting the demand that we need to and the flow that we need to be able to recruit into this pipeline. And year after year, we're at that point where we're missing targets for recruitment. And so that's why it is deemed a national security issue.
It's fascinating. I think most people don't realize that. I think that A, that we're having such recruitment challenges, and B, that nutrition is a big piece of it. So tell us the latest and greatest from the company. Where are you at in terms of the product?
Yeah, so we've launched the app. It's in the App Store. It's available there. Folks are downloading it. We're working with these young recruits in the Air Force population we just talked about. We're working with them very closely to help them maintain their weight that they need to be able to successfully complete recruitment. Folks are going through, we're really excited about this opportunity because it opens up follow-on opportunities for us in other branches and other timelines as well during service. That just one opportunity has all of these cascading effects for us that we're super excited about.
Yeah, that's what I was going to ask. Sort of what are the other sort of partner potentials? Obviously, so you're thinking DoD.
Yes.
But what other groups would you like to partner with?
Yes, we're looking at look-alike populations, so you can imagine law enforcement, firefighters. There's so many groups out there that need similar help. And this is not just eat healthy, period. This is eat healthy so you can perform in your job.
Interesting. How does that change the actual content that you're sharing or the tenor of the content to make it workforce readiness?
Yeah, no, that's an interesting one because you can imagine reading a nutrition label. It cuts across. You can be someone with diabetes, you can be pre-diabetes, you can be someone who's 17 years old. Did you know how to read a nutrition label when you were 17?
No.
Yeah, exactly. Me neither. So these are tough things that you have to
I can
kind of
barely
figure
read
out.
one now.
Oh, I know, I get you.
Yeah, I need all the help I can get.
I get you. But these are complicated things. They're not made easy. And so as you move into this journey, you realize quickly that these are common factors that cut across disease states, age groups, and there's a lot of work that can be done at a very basic level. Now, there's also disease-specific content that we're creating, but then there's some basic nutrition information that cuts across.
That's awesome. What are you most excited about for the next 12 months?
For the next 12 months, all these opportunities that will be created for us. We're also raising our seed round soon.
Okay.
So that's another big one for us, and all the partnerships that are in the pipeline for us. We just can't wait.
What will the seed round enable you to do?
To exactly expand to other branches.
Okay.
We're also amping up our content, the dietitians on staff, the subject matter expertise we need. So creating the Peloton of nutrition is going to take a few dollars.
Yeah. Shireen, I love what you're building. Thanks for taking a few minutes with me today. We'll be watching what you build next.
Thank you so much.
All right. Take care.